Next, we're going to talk about COVID-19, and Tim was going to give us a update, but we got an email yesterday from Dr. Cuthbert, and so if you wouldn't mind coming to the podium and speaking to us, and Dr. Lee, and if you want to introduce everybody, go right ahead, and just go ahead, and then when you're done, I'm sure there's going to be some questions, because this is one of the things we are talking about today. Thank you very much.
Hi, everyone. Mayor, councillors, Jackie, city clerk. I know all of you. Tim, but I'm not sure I know Jim. Hi, nice to meet you. I'm Tara Lee. I'm one of the family docs in town. This is Dr. Cuthbert. Dr. Gould is a family doctor in town. Dr. Harrison graduated from my residency program last year, but now is in a third year of emergency medicine in Swift Current. And then Dr. Claire Kozrowski, who is a family physician in Gull Lake, but she's also, are you still a representative for the SMA?
Yes, I am.
Yes.
That's also in my role on the board of directors for the Canadian Medical
Right.
Association. I am the Saskatchewan representative there at national meetings, and by virtue of that, I'm also back in the boardroom at the Saskatchewan Medical Association, but I have been past president of the Saskatchewan Medical Association. So
Yeah.
a lot of pride in coming from here, and I want to keep that up.
So I'm sorry to bring this heaviness to all of you. We are a delegation of the physicians in Swift Current. There's a lot of us that can't be here, so Dr. Kevin Wasco has provided me with a statement he would like to make, Dr. de Klerk, as well as there were 23 of us that went yesterday to the school board and all the physicians in town. And we are here to advocate for all of you. We're advocating for you. We're advocating for your spouses, for your children, for your grandchildren, for your extended family. We're not just advocating for ourselves. We are service-oriented people just like you. You're here today for the greater good, and so are we. We are at the worst time in the pandemic today. It's the worst. And I think when you're not in it, like when I'm not in my clinic and I'm not working clinically, I kind of forget, the gravity of the situation. It's not real. It's not right in front of me. And so I think sometimes that's what's happening in the public. These are numbers now. We get numbers every day, and we kind of just, we've lost the reality of what's going on. So today in Swift Current, we have no ICU beds available for you. We have 4 ICU beds that are full with COVID positive patients that are unvaccinated. We have the ability to have another 5th ICU bed that we were able to open up yesterday, but today we don't have staff to take care of a person in a 5th ICU bed. So that means if you have a heart attack in the next 5 minutes, if your child or your grandchild or someone needs that bed, it is not available to you. The other night, we had to send out a child who had COVID, and it took 6 hours for a plane to get here because we are flying people all over this province to take care of them. A couple weeks ago, we had to take Meadow Lake patients. Yesterday, we took a Kindersley patient because all of their ICUs are on bypass. Today, Swift Current's on bypass. When that plane started touching down for that child, a young person my age had a stroke. So then the ER doc had to determine who gets to go on the plane. This is what we are dealing with on a daily basis. So I just thought I should bring that to you, and this is why we are here. Unfortunately, we and you have to do this now because our government has decided that they are not going to be in the difficult position that they've entrusted themselves to be in to make these decisions for the province. So now we have a patchwork of things going on. People want to know, well, I've been vaccinated. Why do I have to wear a mask? Or why are the numbers getting better? Well, because we don't have any public health orders. I've brought statistics for you, and it's very clear that since the public health orders have been lifted, our numbers have exponentially increased on a rapid rate, the worst in Canada. So now we are at the precipice of us locally having to try to advocate to help the greater good in the community. You're going to hear people say, well, I don't want to wear a mask. I don't want to get vaccinated. If I get COVID, I take full responsibility for that. We have not had one unvaccinated person not come to the hospital when they can't breathe and say, okay, you know, I take responsibility for this. No one's staying home when they get COVID. The unvaccinated who are taking up a bed for a surgical patient are not finding a bed for you when you need that surgery that are now canceled. Our surgeries, our elective surgeries are canceled. So it's not about the individual at this point. It's about the community. It's about our society. It's about our healthcare system. It's about all of you, the children, the people that cannot get vaccinated at this point. It's not fair for them. You'll hear people say masks are bad. They are harmful. No, they are not. They are not harmful at all. We have not seen children come in to our clinics. None of us. We were asked this yesterday. All the doctors kind of went, We have not seen children in our clinics with abscesses or mouth infections or teeth infections or anything because of masks. They are a nuisance. I agree. But we're in a pandemic. This is what we have to do in the short term, or else there's no end to this. It just gets worse. You know, we have parents that want to send kids to school without masks because their kids can't breathe. We've seen kids with COVID that can't breathe. Being able to say that is a privilege. Being able to say, I'll take responsibility if my kids get sick, my kids can't breathe, this and that. That's a privilege because they have not witnessed somebody dying with COVID. That's the only time you could possibly make that statement. So we come here today to ask you to have to make the hard decisions because our government hasn't done that for us. What we would like for you to do is that you step up with indoor masking mandates. Masking is effective. We can provide you evidence for that. We know that it's effective. If I'm wearing a mask and you're wearing a mask and I have COVID, the likelihood of you getting COVID is much less. If one of us is wearing a mask, it's not as great, but there's still some protection. If neither of us are wearing a mask, then there's very little protection. And people that have the vaccine can still get COVID because we do not have herd immunity. In places in southwest Saskatchewan, we only have 12% uptake of the vaccine. 12%. That's it. So when people say, well, you know, we hear, well, it's not fair. I got the vaccine and now I have to wear a mask. Well, number one, the vaccine will help you. If you do get COVID, you most likely won't be in our ICU and take up a bed, and you won't die. People with the vaccine are not dying unless they're very, very elderly with lots of complex medical conditions. But we're not seeing them in ICU and they're not dying. The only way for this to stop, and for people, we want our lives back to normal. We have kids. I have kids. I have family. I want them to go to school. I want them to play sports. If we don't do something, this will not happen. Hockey is going to, we're not going to be able to continue with sports. We're not going to be able to continue with football. There are so many kids getting COVID, and every day, every single day, more and more and more. It's not going to happen. So we need the numbers of immunizations to increase as well. And that's where you can help. Because we are also asking you to create a proof of vaccine policy for all city workers modeled on the Saskatchewan Health Authority policy. It's been created. It's there. You could look at it. You don't have to do much work. We also ask that a vaccine passport system be created for City of Swift Current owned and operated facilities and encouraged for businesses in the community. I'll just read some of the stats. So I told you about Swift Current. It's not good. In Saskatchewan, we've had 1,000% increase in COVID since early July. Today marked the most new cases in a single day of 508 today. This is the second day in a row and the first time we have ever exceeded 500 cases in a single day. 35% of those are under age 19. I brought some stats for you today. The highest cases are in the age groups 39 and down. That's who's getting COVID now. We have an all-time high number of acute care admissions, 223 in hospital. Over half of our ICU beds are filled with COVID patients. There's 43 of them in ICU today. In Swift Current, our ICU beds are full. I've already told you that. There's none. We continue to have the lowest proportion of society that is fully immunized. That's the problem, is that people are not getting vaccinated. And then they don't wear masks. We basically have no public health orders at this point. There's tons of people walking around without immunizations, and we're not masking. This is the cause of what's happening today. Masks are an effective way to reduce transmission. It is estimated that they reduce spread by about 50%. They are a temporizing measure until enough of the population is fully immunized. It is not true that they would reduce oxygenation or lead to bacterial infections. They do not cause harm. They should be mandated at all public spaces. The City of Current should mandate them in city-owned and operated facilities and recommend that businesses in the community follow suit. Vaccine passports have been implemented in other jurisdictions. When that happened, immunization rates jumped. Their purpose is twofold. They encourage more people to get vaccinated, and they reduce the number of unimmunized people from entering public spaces. We know that the vast majority of COVID cases are spread or due to unimmunized individuals. And I'd just like to make one more comment about, this whole, you're affecting people's freedoms. We're not making people get vaccinated. We're just saying that if you're not vaccinated, there's limited things that you can do. We're not making people get a needle. They are making a choice not to. They can still access all the basic things that they need. But at this point, if you are unimmunized and you are walking around without a mask on and you have COVID, you are spreading that to children. You're spreading it to each other, to the unvaccinated, and the unimmunized are taking up space in our hospital, and now it is affecting the general public. Surgeries are canceled. If you have an emergency today, we're in trouble. Oh, and then the one more thing about the Bronco games. I think you know about this. The physicians in town who cover the Bronco games will not cover games unless there's a mask mandate and a proof of vaccination policy in the building. That's for many reasons. Obviously, number one for us as the community, it's a very unsafe, ridiculously unsafe building to be in when all those people are unmasked, and vast majority of them are going to be unvaccinated. There'll be COVID spread like wildfire in there. There's lots of indication that hockey rinks harbor COVID because of the humidity in rinks and the plexiglass. If people are yelling and coughing or whatever, the virus is airborne, number one. That's why masks are important. The virus particles actually get caught in a certain layer in the plexiglass. And it's very transmissible in a hockey rink. And so you will have kids exposed like crazy in the Bronco games. It's the worst case scenario. It would be like a super spreader event. So we can't condone that or be in a facility like that. That's what I have to say. I'm sorry to take up everyone's time, but Jana, do you want to say anything?
I'm sure there's going to be some questions. I know I have some, but I will open the floor for councillors first. Do you have any questions? Councillor Wall, go ahead.
Yes, thanks. Thanks for your presentation. The kids under 12, how many cases have you received for the kids under 12, and why can't we vaccinate them?
So today, this is new cases status since September 13th. There's 101 new cases in 0 to 11. And we can't vaccinate them because it hasn't been approved yet.
But we are close,
Yeah.
within months. This is short term.
And the other question I have, I've been vaccinated, I have a card. Mm-hmm. Is that good enough to go, like if I want to go to the hockey game, just to show the card, or do I need to have that other?
The province is working on a QR code, and apparently it's very user-friendly. You just have to you download the app, you put in your date of birth and your healthcare number, and that'll be available. But that's not going to be, I think they said September 20th. Prior to that, your card would be fine, or a printout.
Yes, you can download a certificate from the eHealth viewer.
Thank
But
you
the
very,
card's fine.
thank you very much.
Go ahead, Councillor Plus.
Thanks. First of all, before I get into anything else, I just want to say thanks to you guys. I know what you're going through right now is not easy to do or easy to see. And, you know, it's not a new role for doctors to be advocates. And I just want to thank you guys for coming today and bringing those concerns to us as a council. I mean, I've heard from several of you individually already about this sort of very stuff. And, you know, I'm also a member of the temporary, at least until the AGM. I would be coming off as a member of the Broncos board at that time, but I still am in, and so I'm aware of the discussion that's happening with the physicians. And so I guess, you know, what I'm wondering is, because I know other communities have looked at sort of a passport, for a lack of a better term, in their facilities, but are having to back off that slightly, at least in the short term, because we really don't have a really great way yet, an easy way of presenting your vaccine status, or negative test status is in some places is being accepted as an alternate to that. You know, let's just say, for example, and of course, like, no discussions have even happened here yet officially. No decisions have been made, but just for the sake of argument, if we were in a situation where we could say, look, we can do masking. I mean, that's easy enough for us to do if it's a city facility, to say, you know, you have to wear a mask if it's a city-owned facility or a city-run event. You know, we can check that box, but if we can't check the others, is that going to be something, even in the short term, that's going to prevent us from being able to, say, have a hockey game? Like, you know what I mean? If we say, you know, we're not necessarily opposed to getting there, but until we can sort of do that at the same time and in the same way as other cities that are able to do this, you know, is that sufficient for the short term?
I would have to bring that back to the group that does most of this, which is Dr. DeClercq, Dr. Gatsky, and myself, and
Yeah.
Dr. Peterson. We've talked about that. Like, what's happening in Moose Jaw is the doctor is going to sit in the players' room, essentially, and sit there the whole game. Because what will happen is people will unmask. They'll get their drinks and they'll get their food and they'll sit there and they'll eat and they'll drink the whole game without their mask on. Now, I mean, what if that one person creates 100 COVID cases in that building? And we see 5 or 6 of those in our ICU, or even one person dies from that, or 2. Or Laurel Schaefer was going to come here. She's a physiotherapist in town. She has long COVID. We are seeing a lot of this. This is a significant, severe disability. She couldn't come here today because she was so exhausted from yesterday she couldn't leave her house. So what if us just saying, sure, let's just do that, creates one of you to get that, or one of you to die, or one of your children, or this is huge. I understand hockey is a big deal. I like going to hockey games. I want to do this in the worst way as well. But I want to prevent seeing my community members and my patients and kids and people suffer. So to us, sometimes there's got to be a line in the sand, because if we do that and I have a huge sense of responsibility. And I think, you know, yesterday when we were getting all these questions about, well, my kid doesn't like it and this and that, it's not about the individual at this point. It is and it isn't. It's mostly about the community and about society. And this has made so much, it's so sad to see that we have degenerated as a society to the point where we can't wear a mask, we can't do certain things because it's bad for us. Well, what about everyone else? And we have to ask ourselves at some point, in my opinion as a physician, what I'm okay with. If I go sit in a rink and I'm sitting there where the doctors sit and there's all these people around me drinking and eating with no mask, and I don't know their vaccine status, and I don't know all these kids in front of them, and I'm contributing to that. Maybe in a week, that child presents to the emergency room. I could have prevented that to go to a hockey game. We have the ability to do these things. We could say, you need your card. Kids can go. Children under 12 cannot get vaccinated. It's not their fault. But everyone else has ample opportunity. It is free. We are a privileged country. We are basically, some people are getting vehicles and this and that to get a vaccine.
Dr. Lee, you're speaking, I think, to the converted here on that point, okay?
But what I'm saying is,
I
I'm
know.
being asked to go, I understand there's pressure because the Bronco game can't go on if there's no physicians there. All we're asking is someone to show up with a card.
So I'm going to just carry on here. So let me just say, I've always been a person who strongly believed in asking experts what they think and sort of accepting that because I'm not an expert. There's, I have certain expertises as well, and people come to me for that because I'm trained and experienced in providing that kind of advice. It's exactly the same for you guys. I completely accept that, let me just say first and foremost. And I will also say that despite, without getting too political on this, despite supporting the province in many ways, I'm very disappointed with the approach that's being taken by the provincial government on this. I think it's not good enough. And I think what you say when it's, the worst time in the pandemic with the least restrictions that we've had, I listen to that, I hear that, I believe you when you say that. I'm not in the ICU. I'm not looking after patients. I don't see what that side of things is. But I also trust 100% that when you guys are telling us that that's the case, that's the case. And when you tell us that we're at a time where we need to do something, that you wouldn't be coming to do that lightly. So let me just say that I accept that. I wish that the province would act on this, personally. I wish the province would do something with it because they're the ones who have the power to actually enforce it. That's the real problem that we have. And as you said, we've got a patchwork of different municipalities and different organizations like the Riders, for example, who are acting on their own. The city can do certain things. Certain things we can do and we can enforce. There are some things that we could try to do that might not be enforceable. And there are things that, frankly, we can't do because municipalities have different abilities than the province has. Like we don't have the ability to pass a public health order.
Right.
That resides with the province. And as much as I wish that they would do that, they haven't yet. Hopefully we do get to that point. But so just to be clear, you've got three asks, and I'm going to repeat them and tell me if that's wrong, but I want to be very clear about what it is that you're asking us to consider. So number one, indoor masking mandates in city facilities and at city events, and also to have the city recommend strongly to private business that they implement the same thing. Number two, proof of vaccination policy for city employees. And number three, a passport or a vaccine passport for city facilities and events.
Yes.
Okay, good, thank you.
I'll take the request about the hockey game back to the other docs, but for myself, I can't see that I'm going to sit in the Bronco dressing room for all the games until we come up with something. I don't know if Dr. DeClercq or Dr. Gatsky, I know Dr. Peterson said no, she won't.
Yeah.
So,
And I only ask because I know that, Regina has had to backtrack a bit on some of what they wanted to do, right?
Yeah.
And as much as we want to get things right if we're going to do them, it would be kind
Dr.
of a
Gatsky
mess.
or Dr. Clerk might, I don't know, I can't
Yeah.
speak for them.
And Regina didn't back up a bit. They backed up to the middle of November, and they were going to do it by the end of September here. So they backed up almost 2 months. And to make that point on the passports and the vaccination and the negative COVID tests. Any other questions here, Tom or?
Yeah, I've got just a
Go
couple.
ahead there, Leanne.
My son-in-law is a teacher in Alberta, and of course Alberta has locked down again, and we had quite the conversation, and he said he's just tired of it. Everybody, there should be a vaccine mandate. like there was for smallpox, and everybody should get it for the collective good. And nobody is thinking of the collective good anymore. They're thinking about themselves. Anyway, there's a very vocal component in town and locally about RNs being against vaccination. So when people hear an RN won't get vaccinated, what are they against?
Is that an RN in town or this group, this Canadian Frontline Healthcare
No,
Workers?
this is an RN in town. She's retired RN in town.
Oh, well, so what I say to this, because I hear all this stuff, is there's the frontline workers and the healthcare professionals, these people that are, you know, against it, they absolutely cannot be people that have witnessed COVID. I mean, if she's retired, maybe she hasn't been in the workforce for a while, because you can't see and do what we do
And
and
not
be
get
against
vaccinated.
it. It's just, so the healthcare professionals that wrote a letter in BC, because they were anonymous, I'm assuming they were massage therapists, naturopaths, I don't know.
Okay.
I'm not sure.
I'll just say this would be a very small and possibly vocal minority. We have been incredibly blessed here in Swift Current to have a team of healthcare professionals committed to this throughout, working together as a team.
Okay, that's good to know.
I mean, I don't know. I can't speak to that because I haven't heard about that and I'm not sure why
Okay,
that would be.
okay, and the other question I would have that people are asking is about the backlog of results for other people being able to get their test results. There's a lady in town who had a biopsy done, and she says it's going to take 4 to 6 weeks to get the biopsy results back because she was told the delay is because of COVID. So I'm not understanding, doesn't the COVID results, if you're just being tested, go to the Romano Center?
There shouldn't be any delay and in fact, we found that biopsies were quicker because surgeries are canceled. So when surgeries are canceled, there's no organs to take out for the pathologist to look at. And therefore, all the biopsies that we did were getting done like this because the pathologist, there's no surgeries being done.
So it shouldn't take 4 to 6 weeks for her to get her
That's
results back.
that's not been our practical experience. I have cut things out in the last 2 weeks and had results on my desk. So
Really?
I'm not, and of course we can't speak to individual cases, but that is not a
Not the
general
experience that you're having?
Like specialized types of pathology that takes longer even at a
Anyway,
So I don't, it's hard to say.
There are tests that go across North America for specialized tests, so that can happen.
okay.
Like for certain breast cancers, they do immunotherapy, staining, all sorts of genetic testing. Those things, those go to BC sometimes. Sometimes they go to Toronto. There's some specialized stuff, but
Yeah, there was a time when we had certain tests actually that we couldn't order, so that we could
Yeah.
prioritize COVID tests. Those have all gone the way of the
So
dodo
being
many
told
months
it's
ago.
because of COVID isn't correct. I'm
Not
not saying
for
I'm not saying her
biopsies.
doctor
Not for that
told her
kind of
that,
thing.
but being told that it's because of COVID probably isn't correct.
But there are many things that are delayed because of COVID.
Yeah.
I have many patients waiting, for example, for joint surgery, and that is absolutely because of COVID.
Yeah. Thank you.
Thank you. Ryan?
Thanks, Your Worship. You had mentioned that, vaccine uptake in some areas was as low as 12%. Within the city of Swift Current, Battleford Trail to Burke Crescent, do you know how many people, what our vaccination percent is here in Swift Current? And is there a number that we could work towards?
I do know, I think it's Swift Current. It's always broken down by age group. So I know that the high school age group is not good in Swift. It's less than 50%.
It was pretty good in the older.
The older age group, like 85 and up, very good. Like I would say 90%. That's why we don't see older people in our hospitals anymore. I want to get the exact numbers. Can one of you text maybe Kevin?
We can get that information.
Yeah, we can get that. He'll know it.
Oh, thank you very much for that.
Yeah, please.
Go ahead.
It was about 3 weeks ago at one of our provincial physicians' town halls. They're broadcast by certain sources, where Dr. Jenny Bazarin, who's recognized as a world expert. She's originally from Cabri. We're very proud of the work she does. She presented to us the epidemiology, meaning showing us how COVID is going right now. So 3 weeks ago, she showed us a curve that was no longer a curve, but became a vertical line going up. Those were real numbers. She had some really sobering information for us, all based on facts. But what she told us is that even if 90% of our population, 90, was vaccinated, at this point, because of that curve going up, we were in deep trouble. If we had 90, and around here we certainly don't have anywhere close to 90, she said, all is not lost. And that's when I started listening again, because before that, it was nothing but depression. She said, but all is not lost because if we have public health measures introduced immediately, that could save us. So that's a different message from what you hear, because I thought, if everybody gets vaccinated, we're good. So what are those public health measures? They're exactly what Dr. Lee was just talking about. It's masking, it's distancing, and it's not gathering. So it was sobering news from her, but it's the facts, and that's where we're at right now. So it's not just Councillor Schweitzer getting those vaccines in arms. Absolutely, we need that. But we're coming to you to ask for the public health measures.
Dr. Roscoe messaged me back, and he said for Swift Current, overall, for all age groups who are eligible, it's 69%.
Thank you. Councillor Friesen, you have a question there? Go ahead.
Yeah, just maybe more of a comment and then a question. I guess first of all, my heart breaks for the situation that we're in. It's just so sad to sit here and listen to all of this. And my heart also breaks for all the healthcare professionals. I know this isn't what you want to be doing. I know this isn't, you want to be taking care of patients and not out lobbying, so to speak. And I'm hopeful that you are not receiving any criticism, negative comments, backlash for what you're doing. And if you could comment on that and let us know how you're being treated. I hope it's very well, but I'd just like to know, given what's been going on in Canada.
We're fortunate in our community. I feel we have a really respectful, amazing community. And I mean, I've lived here forever. Ryan said grad 95, that's me. Him and I graduated together, and I graduated with a lot of people that are still here, and a lot of them are, anti-maskers and anti-vaxxers. And there's been no death threats, yelling and screaming and these types of things. I mean, I stay off social media as much as I can, but none of us, I don't think, have, well, no, I shouldn't. Well, if Kevin was here, he'd probably say the opposite. He's received some pretty negative, rude things on social media. And I think that's where most of people are getting it, because people aren't really willing to come up and say these things to our face. But I think for the most part, we feel safe. I mean, it's hard when you're in a community. You don't, it's just like you guys sitting here. I know this is difficult because people are going to get upset. And, when we go to the rink, my daughter and I, we're one of very few people that are masked. And I get a lot of disdain. Like, what are you doing? We don't have to mask, and so I feel that. And I'm sure, and if you put into place some of these things, you might get that as well. But I said this yesterday, this is the right thing to do wholeheartedly. Like this why wouldn't we do this is the question. Why wouldn't we? I mean, some people might get upset, but I haven't felt threatened. I don't know.
I've occasionally had people hang up during a phone visit or be a little bit verbally abusive, but I've never felt physically threatened.
Thank you. One more comment there, Pat?
Yeah, just as a follow-up, I'm just curious, when you get an opportunity to talk to a unvaccinated person, can you convince them as a doctor that they need to get vaccinated?
The people who choose or who are not vaccinated right now are actually a mixed group of people, you know. A lot of people in my office just have a lot of questions. Everything from how does a vaccine work? How did this get through so quickly? My spouse is concerned about this. I don't get a flu, like everything. Can I convince them? The biggest thing I do is I ask why. I'm like, tell me what it is, you know, I want to know. And try to give support that way. But do I know, do they go ahead and choose it after that? I do have people who have, yeah.
There's definitely a subset that for sure are hesitant, they have questions. I think that's the large part of it. Then there's the apathetic, and I think that's the younger population because they're young and they don't think, I would die. I'm not going to die from this, as if, you know, like, whatever, I don't want to go get a shot. And it's a nuisance type of thing. And then we have the subset of people that there's just no convincing. The conspiracy, I've been told, Biden and Bill Gates decided to do this, and there's all sorts of things, and you're not going to convince that group. But just today at our clinic, we had a vaccine clinic. It was a bit lower today than usual. Usually we have 50 people, and it's only in 4 hours. But today we had 20 people, and 10 of them were first doses. So that's hopeful. We always try to hang on to the little things.
Thank you. Councillor Christensen, you had a question there?
Yes, thank you so much for being here and sharing this information. It's obviously, the more news we can get out there, the more information we get out there, the better off we are. I think the COVID or proof of vaccination is one method that you're hoping will help drive up some of the immunization. Do you have any other thoughts on other ways we can do it? Like, in addition to the passport type of an idea, do you have other thoughts on how we can get these people vaccinated?
Well, we're trying to go to them. So, you know, like the vaccine group will go to the Legionnaire camp. They'll go to the Wildcat camp. They'll go to the places where we're finding the low numbers of vaccination rates. The family docs definitely, we had quite a few family docs that connected with the Hutterite communities, and we did virtual question and answers. That really helped. That's maybe something we should do as a community. I don't think the money thing works. Like in Alberta, give everyone $100 compared to Quebec and Ontario that did the vaccine passports and saw a huge amount of people getting vaccinated compared to Alberta was very low. I don't think that's a good plan, is to try to do the here's some money idea. I think it's talking to people, you know, and answering their questions, why there's a group of just the apathetic, and maybe they'll get it if we bring it to them, or if there's a reason why. Well, I want to go to the Rider game. Okay, if I have to get a vaccine, then I will. And then there's the hesitant because of questions they have, which we're trying to get to them as much as we can. Social media is not helping because every time we have an answer, there's an answer back.
So is there an instance, I know I heard Leanne mention earlier, whether there was a possibility of having a public forum where you were there and have people in to ask and answer questions. Is that something that is in the works, or could we figure out a way to set that up, or?
We will
Sure.
say yes to invitations. Yep, as a group, you bet.
Oh, go ahead.
Thank you. That was in response mostly, I think, to your question, Councillor Talon-Weave, about vaccine hesitancy. I have a good site that we could share with council. It's been created in 2021. It's out of the University of Calgary, and it outlines about 17 different ways people are hesitant to get their vaccine and how to pinpoint the most likely way to discuss and nudge them towards getting a vaccine based on what their particular basis is for their hesitancy. It's designed for doctors to do that, talking to patients, but it would work for anybody who's
Thank you. I have a few questions or comments. We are meeting with our MLA on Friday at 11 o'clock in the morning, and we have other things to discuss, but this will be front and foremost, I can assure you. Minister Hindley is responsible. He is a health minister, not the health minister, but mental health and stuff and seniors. So anyway, we will be asking him about this, okay, and talking to him about
Oh,
this.
we've contacted him.
No, I'm sure
many
you
times,
have. I'm
yeah.
sure you have.
So he
And
knows.
this is a public health order. We do not have the ability to impose that. I see Regina, like I said, Regina's put theirs off. They made the big announcement last week, and now they put it off to the middle of November. So obviously something's going on there that they can't enforce it. So I have some concerns there. A question I'm going to have of you, and I'm not anti-vaxxer, trust me. I've had 3 vaccines, and I've got to go get a 4th because I had AstraZeneca twice, and I want to go to Hawaii. Not like somebody else that is going to Hawaii. But at any rate, I looked at the stats the other day, and basically 30% of the people that caught COVID either were singly vaccinated or double vaccinated. So if you ask for vaccine, proof of vaccine to go to the hockey game, I can be vaccinated, I can still carry vaccine. And so the point that Ryan had made about masks make sense to me. I'm not sure about the vaccines, the vaccine passport, whatever you want to call it. I don't know that makes a great deal of sense to me, because whether we're vaccinated or not, we can carry it. And we can not just carry it, we can get it. And so the rationale there, you may want people vaccinated, but if I'm vaccinated or not vaccinated, I could have went to Walmart before I went to the game and picked it up. I could have went and had a test. If I had unvaccinated, I could have had a test 2 days ago that showed I didn't have COVID. In the meantime, I could go up to Shoppers and talk to somebody at Shoppers and pick up and then go to the hockey game. And so for me, this rationale about these vaccine passports, I struggle with it personally. I really do. The only rationale that I can hear what you gave and what I've heard other people say is it forces people into getting vaccines. I'm not sure that's our responsibility, and I'm not trying to offload here. I know it's not ours. I know it's the province's. That's number one. Number two, how do we enforce it? If we bring in a rule, how do we enforce it? We're going to hire a bunch of vaccine cops? I mean, like what? No, well, no. I don't know what the riders do. I'm just asking for us, because we don't have the money to do that. I'll be really straight up and forward with that, okay? So, the masking, I understand. Even though I'm not masked here, I feel quite safe, but maybe I shouldn't. Maybe I should feel as you are with your masks on. But the vaccines, yes, so 2/3 are unvaccinated, I get COVID from them. 1/3 is vaccinated, I get COVID from them. So basically, I can get COVID from anybody, no vaccine or not.
If you're vaccinated, you're less likely to transmit COVID because you have less viral particles in your nose and mouth and lungs.
And that's the rationale then? If you are vaccinated, even though you have it, you're less likely to transmit.
We can get, I don't know what the percentage decrease is, but there is a decrease that
No.
way. And vice versa, if you get a bunch of unvaccinated people exposed, you're 25 times more likely to be hospitalized if you're unvaccinated.
No, we've all read and heard those stats, trust me.
But you're less likely to transmit, though.
No,
So
no.
that's the difference.
Okay, that's the big one. See, I had a text from a friend of mine in North Dakota, and he did a 24-hour shift. He's seen 65 COVID patients, had to send 12 home without even seeing them. They don't have an ICU bed left in North Dakota anywhere. He said these unvaccinated people, he gave them oxygen, gave them steroids, and said, best of luck, go home. And I mean, that is in North Dakota, and that's not that far away from us. It's one of our neighbors, a little bit of ways. So I mean, I can see that happening here too. I can't imagine just talking to him, him having to make those decisions. You come in with somebody with COVID that needs a bed, and they're vaccinated, and somebody that doesn't need or needs a bed, and unvaccinated. The unvaccinated is 12 years old, or not 12, say 15, and the vaccinated is 25 or 30. And I mean, making those choices are just, anyway, so I understand that. But when Ryan asked about the masking, to me, I'll be really honest, to me, the masking makes sense to me. It really does. But I'm not sure the vaccination cards do, because I don't know how, we can say it, but I don't know how we can enforce it. Because we don't have the personnel to enforce it. We don't have the money to hire personnel to enforce it, because that's not health is not our responsibility. The buildings are, but at any rate, so, and that's something that we'll be asking Everett, or I will be asking Everett, and I'm sure all of us will, when he comes in on Friday at 11.
Yes.
So, any rate, I didn't realize that vaccinated were less likely to spread than unvaccinated, because I just knew you could get it, okay? And then the COVID tests, that's, I mean, you get a COVID test, how long is it good for? I go get the test and I walk out and I meet somebody in the street and I pick up COVID. And
Exactly.
I mean,
And we talked about that as physicians that would be at the Bronco game, right? This whole get a test 72 hours before, you can pick it up before that. So the other thing that the one other thing other than the two that Mo said on Friday that could be useful is that they are going to pay for a whole bunch of rapid tests or have those test kits available. And as you said, that takes up human resources, right? Who's going to sit there and get people to take a test right before? This is something, I guess, I don't know how you operationalize this in a cost-effective way or what you do. The vaccine passport, it will be a provincial thing. It's going to be a QR code. I don't know if at the Bronco game, you give your Bronco ticket and your vaccine passport would be at the same time. Those would be the people. It's just if you don't have a ticket, you don't go in the door. The same as the vaccine passport. I don't know about the testing, to tell you the truth.
yeah, but I mean, the Bronco game's one thing, but every hockey game, every minor hockey game, I mean, the same thing. Who's going to be standing at the door? Because right now, for minor hockey or for figure skating or for indoor soccer or for whatever it might be, basketball, volleyball, all those things, we don't have people standing at the door. The Bronco game's the easy one, just like the Ryder game. I mean, yeah, it's going to take them a little longer, but someone's at the door. But these other places, we don't have people standing at the door. We would have to put someone there, and we'd have to police it. And so for us, when I read what Dr. Wasco had asked a little earlier today, I'm just going, I don't know how we can enforce that.
Yeah.
I really don't. And so, like I say, when Ryan asked about the masking, that makes sense to me, and the other might make sense, but that's maybe something where we can put some pressure on our MLA, who is a minister in cabinet, to take our ideas back to cabinet, because believe me, I'm sure they're talking about it right now. They'll be talking tonight, and by Friday we may already have an answer, because I did see him yesterday afternoon. I'd seen him at the mental health sod turning, and we discussed the Broncos and the masking and the vaccine passports, and we spent about 5 minutes just kind of behind the lines there talking about that. And so, at any rate, if there's no more questions, I mean, it's something. Oh, we got a comment in the back row.
Thank you, Jen. A couple of things. The question about RNs, you may have seen the docs look at each other. I've never heard of an RN being
Not locally.
against it. Well, I can't give you her name. So it's not a common thing, okay? It's not. We work with a great number of RNs, and I talk to lots of RNs and LPNs, and so that's a very small minority, I would have to say. Secondly, Dr. Tor, our medical officer of health, medical health officer, was in Moose Jaw yesterday, and Moose Jaw City Council yesterday made a decision in favor of increased regulations. So there's certainly precedent for a city like Swift Current to listen to some of these asks and be able to go forward.
It's easy to make a decision. No, I shouldn't even say that. It's not easy to make a decision. It's easy to put a decision on paper, but it's another thing to enforce a decision. And that's where my concern comes, and that's where the concern in Regina is right now with the city of Regina. And they have a lot more resources than we do. And they've already been talking about this for weeks, and all of a sudden they say they can't do it for 2 more months. So there is a real concern there.
In particular, got to start with the political will, and I know you can be willful. Thank you.
Yeah, I think just to be practical, like for us, like the vaccine passport is for the physicians. I understand the city. You need physicians to be at the Bronco game for it to happen. Even if you started there, I understand minor hockey and sitting at the Fairview, whatever. Just implementing masks will be huge. Because if you don't, I mean, hockey's going to be, pretty soon it's just not going to be able to go. It's just a matter of time before there's a COVID positive kid there and all the hockey's going to be shut down. Masking, as you said, you can implement that. You don't have to enforce it. The vaccine passports for the minor hockey and other things other than the Broncos, you can work on. I mean, doctors don't need to show up there.
We could ask the Broncos to get a backbone and enforce their own vaccine rule too.
Yeah, that too. I mean,
No, I mean,
That-
seriously, I mean,
yeah,
without
we're
being,
we're talking with the Broncos on Wednesday, so we're
Okay.
going there on Wednesday. We're going to all the groups saying we all need, like, let's do this.
well, I would like to wrap this up because we do have some more business. Thank you so much for taking the time. Thanks for the email yesterday. It was very timely. We were talking about this today anyway, but without your expertise, we would have been talking in very short circles or small circles. So thank you. And we are going to conclude this portion, and we are going to talk about this when we go in camera here with nobody listening. Okay?
Thank you very much.
No, thank you. I sure appreciate it.